the outcomes of an all-nasal approach to lens-sparing vitrectomy in stage 4B retinopathy of prematurity. I have no financial disclosures for this talk. Lens-sparing vitrectomy has been established as the standard of care for management of retinal detachment associated with retinopathy of prematurity. Its main advantage is the phakic condition it leaves the eye in, which provides for better visual rehabilitation and also for lesser chances of glaucoma. With the advent of the small gauge vitrectomy systems, LSV has gained wider acceptance rates, and success rates have also come up to about 80 to 90% in especially stage 4A ROP. But it certainly has some limitations. ROP we know is a disease that is inherently more severe in the temporal half. So there are conditions in which there is temporal traction and peripheral traction where this technique may not be possible. Gadkari et al. Had shown that lensectomy was required in 11 of the 32 eyes in stage 4 ROP with peripheral traction. And similarly, another study by Address et al. Showed that 57.1% of the eyes with stage 4B ROP required lensectomy along with. So what happens in stage 4B with the raised temporal traction is that when we put in the trocar over there are chances that we are either going to hit the retina or we are going to go through the retina. So we tend to go more horizontal, and that requires a lensectomy. So we thought that can a different approach provide a better solution to this? We decided to shift nasally. The surgeon sat nasal to the eye that is being operated, and we were operating from over the other eye. The nasal bridge of the infants is shallow, so that helps in this approach. And also this centrally placed infusion cannula kind of was held over there by the shallow nasal bridge and did not flip and hit the lens. So that was an added advantage that we realized after starting doing the technique. And rest of the steps are very similar to what we do in a normal lens sparing vitrectomy. I'm just going to show one representative video. We can see the infusion cannula placed in the center. This is the right eye being operated, and the surgeon is sitting on the left side and operating from over the left eye. The first port goes in for the infusion cannula right in the center. So this won't be possible in adults because they have a high nasal bridge and it won't be possible there. But here, this kind of shallow bridge kind of supports it very well to facilitate all these steps. And since the hands do not cross during surgery, so this centrally placed cannula kind of does not interfere in your surgical maneuvers that you are doing. So you can see this tractional retinal detachment in stage 4B ROP involving the fovea, and the intraoperative OCT showing this steep temporal detachment that is approaching up to the lens. So had we decided to go with a normal approach, this in all likelihood we would have done a lensectomy in such a case. And this we are now doing it from the nasal side, trying to dissect the traction between the ridge and the lens. Now this is between the ridge and the periphery. You can see some part of the retina has gone back since the traction has been released. And this is the ridge to ridge traction. This is the superior and the inferior arcade. And this is the traction that is bridging between them. So the vessels that are crossing between them are being cauterized. They are the new vessels, and then the fold is opened up over here. So this almost kind of concludes the surgery, and you can see the release of the traction as evident on the intraoperative OCT. And we close the case with a partial fluid air exchange. So these are some of the other cases that we have done, which have had a good outcome. And out of the 8 cases that we have experience with, we had a 75% success rate. And in just one case, we had a lens touch in which we had to sacrifice the lens. Whereas if we had applied the standard approach, almost 80 to 90%, we would have had to sacrifice the lens in this. So to conclude, stage 4B ROP can present with temporal tractional retinal detachment approaching the retrolental space. Achieving the surgical objectives in these eyes using the conventional surgical approach usually requires lensectomy. Our novel all-nasal approach may be useful in some select cases, and the central placement of the cannula was specially advantageous, keeping it away from the crystalline lens also. Thank you. And I would like to acknowledge my mentors, Professor Dogra and Dr. Diksha, who have pushed me into this field of pediatric retina and have guided me.